This is a complaint that I keep receiving over and over in my facial rejuvenation consultations. My patients all tell me they've tried everything: fillers, collagen stimulators, threads, and nothing seems to be working anymore. As a board-certified plastic surgeon focused on advanced facial rejuvenation, this is one of the main concerns that my patients between their 40s and 50s really complain about. And the reality is that while fillers tend to be a fast solution, it's generally not the best one because facial aging occurs in many layers and it's not just a matter of volume loss. That's why when you're looking for a structural and long-lasting result, the conversation really has to change. Why most patients start with fillers? The truth is that us, facial rejuvenation surgeons, have to already get used to the fact that most patients that come to us have already used a sort of filler, collagen stimulator, or threads. And the reason is that while surgery gives more structural and natural results, patients that are starting to come down this road prefer to start with a less invasive procedure that has less of downtime and probably less costs. But the truth is that fillers are a good alternative when the changes are not really that major, when you have clear the limitations of this procedure, and when you know when to stop. Because different from the surgery, fillers have a big limitation, and is that its advantages are temporary, while its negative consequences tend to build up over time. All these sort of less invasive procedures tend to have something in common, and it's that the results may not last, but the negative consequences, as I mentioned, tend to build up. So there's scar tissue that keeps building up because every time you repeat the procedure, you cause more and more and more. Especially with collagen stimulators, what happens is that the dermis tends to thicken, and this is irreversible. So if we start looking at the faces that look super bloated and super swollen, and it's really a matter of thickening of the dermis that you cannot take back. The product, while it is reabsorbable, some of it never goes away. So when I do my facelift procedures, I tend to find residues of the products in the skin, in the deeper tissues, and even close to the bones. And the last and my least favorite one are threads, which is a procedure that is super painful for patients, and those threads tend to have results that last even less than a month, and the threads remain in the tissues, and they cause perforations on the mass and the deeper tissues that may compromise the effectiveness of a surgical rejuvenation surgery. So how is surgical rejuvenation different? Before getting into different facelift techniques and surgical rejuvenation surgeries that we have, we need to understand first what is the science behind facial aging, because these are the changes that we're going to want to approach when we're doing a facial rejuvenation. The skin changes not only because of sun exposure and the wrinkles that we have because of muscle contraction, but also there is more skin laxity with less elasticity to come back to its position. There is volume descent that forms certain patterns together with the position of the ligaments that go from the bone to the skin. So we have tear-through ligaments, the marionette lines, and also the jowls that form as a result of volume descent around the permanent ligaments. There are changes on the neck because of looseness of the platysma muscle, looseness of the fat, and also what gravity causes the skin to fall down together with the rest of the tissues. When you're addressing facial aging, you shouldn't think about just volume, and rather address all of those changes that the face tends to present with time. The deep plane facelift is a structural and long-lasting approach to facial rejuvenation, and it's because it addresses each one of these changes. So we release the supporting ligaments of the face just to liberate those restriction zones. We reposition the tissues. We re-stretch whatever was super wrinkled, and we remove the excess tissue, not only on the skin, but also on the deeper tissues. At the level of the neck, we remove the extra fat that bulges under the skin. We do a muscle repair so we can correct these platysmal bands, and we also do a deep plane repositioning, fixation, and removal of all of the extra skin. Since facial aging doesn't only occur at the level of the mid-face, lower face, and neck, deep plane facelift techniques tend to most of the times be combined with other procedures so that we can have a comprehensive result. For the upper third of the face, we can do a brow lift. We use botulinum toxin or Botox to treat the wrinkles at this area. We do rejuvenation of the periorbital area with upper and lower eyelid surgery, and also we have to address the skin changes. My preference is generally technology rather than fillers or injectables. I like to use procedures such as microneedling with the skin pen together with exosomes or PRP to improve the quality of the skin and give like a collagen boost for it, and also radiofrequency to stimulate the production of collagen at the deeper tissues. So, while fillers are a very commonly used alternative for facial rejuvenation, it's not really the most natural or efficient one. So my recommendation as a facial rejuvenation expert would be to address all of the areas in facial aging. Have a great skincare routine, wear sunscreen every day, use technologies for your skincare, and then when you notice changes that cannot be handled with this type of technologies, it would be better to skip the fillers and just think about going for a straightforward and long-lasting solution that would be a deep plane facelift. Social media and the internet are collapsed with lots of information regarding different treatments that you can get for facial rejuvenation. But the best way to make an informed decision is to have a consultation with an expert who understands your needs, who wants to give you a solution that lasts for longer rather than taking your money. So the first step is just to have a consultation. If you have any other questions regarding facial rejuvenation, please leave them in the comments below.